Okay. Good evening, everybody. In today's lecture, let us learn about joints. The concept in skeletal system. Joints is very important concept because in examinations they may ask you about classification of joints, functions of joints, and different types of joints. Okay. So in the examinations from the joints, you may expect one question. And in previous classes already we have started skeletal system. In that we studied about axial skeleton and appendicular skeleton. Axial and appendicular skeleton, that different types of bones, that all we have already discussed. So in today's class, let us try to learn about joints in detail. Okay. See, how do you define joint, or what do you know about joint? Joint का meaning क्या है? What do you know about a joint? See, joint is something which is articulation. It is articulation. Articulation means junction. Joint is the articulation between one bone to the other bone. It is the articulation, or it is the junction between one bone to the other bone is called joint, or it is the articulation between bone and cartilage. It is also considered as joint. Let me repeat the point. Joint is nothing but it is the junction, or it is the articulation between bone and bone. It is considered as joint. And it also, see, joint definition, the articulation between bone and cartilage, this is also considered as joint. And sometimes joint is also that articulation between a bone and teeth. Bones, just imagine we have maxilla and mandible. In mandible we have bone. This is bone. In bone, certain roots of the teeth is connected, or it is inserted into the bone. So this connection, or this junction between teeth and bone, this is also considered as joint. So let me summarize. Joint is nothing but it is the articulation or junction between bone to bone, bone to cartilage, and bone to teeth is called joint. Understood what is definition of joint? समझ गए? Joint का definition समझ गए सब लोग? You have to tell me. Okay. Now you see. Just now, as I told, joint is also called, it is the articulation or arthrosis, or it is a junction between two bones, or between bone and cartilage, and between bone and teeth is called joint. And the study of these joints is called arthrology. And study of the disorders of this joint is also considered as arthrology. And if any joint has disorder, or if any joint has inflammation, that is called arthritis. याद रख लो, what is arthritis? Inflammation of joint, or disorder in the joint, pain in the joint, or what we can say, accumulation of fluid or any damage in the joint is arthritis. Okay. About joint disorders also we will try to discuss at the end of our lecture. So you understood what is joint. Joint is nothing but it is the articulation or arthrosis between bone and cartilage, and bone and teeth. Simple. This is the definition of joint. So see, in joints we have different types of joints. In types of joints we have so many types of joints. Based on the structure and based on the function, we have different classifications, different types. So we'll try to discuss all the types of joints, and we will try to discuss different what we can say, features of different joints, how they are different from each other. That all concepts we'll try to discuss now. Okay. See, just now I was telling you, just now what I told, joint is nothing but it is the articulation between bone and bone. See, this is one bone and this is one bone, and in between these two bones there is one junction. This is joint. Okay. And sometimes the joint can be present between bone and cartilage. There is a cartilage here in between the bones. In between the bones there is a cartilage. So the joint is present between bone and cartilage, cartilage and bone. So, okay. In definition we already discussed, joint can be considered the articulation between bone and cartilage also. Okay. And the third one, we have joint between teeth and bone. Okay, teeth and bone. So these are different criteria which the joint definition has to fulfill. Joint definition may all these things it should fulfill. Okay, and see, while writing the joint, you can write it is the articulation or junction between bone cartilage and bone teeth. You have to write these 3 points. Then only the definition is correct definition. If you miss any one of these concept, bone definition is not complete. Okay. Now, see, based on the structural different structures of joints, we have based on the presence or absence of synovial fluid and synovial cavity, and based on the connective tissue which is present between joint. See, just imagine there is a bone. Okay, there is a bone, and there is another bone. Okay, in between the bones there is a synovial fluid. There is a synovial fluid. This type of joint is called synovial joint. And there are certain joints, for example, this is one bone, and few bones are attached without the presence of synovial fluid. Here you see there is no attachment, or there is no presence of synovial cavity and synovial fluid. यहाँ पे कुछ नहीं है, there is no gap at all. So this type of joints are having a very very small connective tissue in between the two bones. This is one bone and this is one bone. Due to the presence of connective tissue between two bones, even this is also a type of structural classification. So this type of joints are called sutures, or they are different types that we will discuss now. So in structural classification, based on the presence of synovial cavity or synovial fluid, synovial cavity and synovial fluid, and based on the presence of connective tissue or not, joints are classified mainly into 3 types. ध्यान से सुनो, this classification is very very important. I am going to classify the joints. Okay, joints are classified based on structure, and joints are also classified based on function. Functional classification we will not consider, but structural classification we will study. Okay, structural classification is universal classification. So in types of joints, in classification of joints, always remember joints are classified into 3 types. In that first one, ध्यान से सुनना, very important. First type of joint is fibrous joint. Fibrous joint. And second type of joint is cartilaginous joint. Cartilaginous joint. And third type of joint is synovial joint. Synovial joint. अब देखो, what is the difference between these 3 types of joints? Very simple. See, in fibrous joint, there is no synovial fluid or synovial cavity present between the bones. No synovial fluid or no synovial cavity. Cavity means empty space. There is no synovial cavity and no synovial fluid is present. But what is present in fibrous joint? Between two bones, there is a very very important fibrous dense collagen tissue is present. Collagen tissue is present. Very thin collagen tissue is present, which will connect the two bones together. That type of joints are called fibrous joints. Okay, and in second cartilaginous joint, here also same, synovial fluid is absent, synovial cavity and synovial fluid is absent. But what is present in between these two bones? There is a cartilage. This is bone, and in between these two bones, the connection is articulation is because of a cartilaginous tissue. It is a connective tissue. Cartilage, we call it cartilage. You know, it's a bony type of tissue. Cartilage is a bony type of tissue, which is as strong as bone, and it is very flexible. This cartilaginous tissue is very important in formation of certain tissues in our body. You know, cartilaginous joints are those joints where two bones are connected together with the help of cartilage in between two bones. Okay, and third type of joint is synovial joint. Here two bones, this is one bone and this is another bone. Two bones are having one cavity, empty cavity, which is called synovial cavity, and this synovial cavity is filled with a fluid, jelly type fluid, which is called synovial fluid. And about the synovial joint, everything I'll explain you now. This is very very important. In exam they will ask you, explain about synovial joint, explain about typical synovial joint. Simple. Synovial joint के different features you have to explain. What is synovial joint, how it is there, what is synovial cavity, what is synovial fluid, and certain what we can say cartilaginous tissue is surrounded around the bones. We have cartilaginous capsule. I'll tell you now. You have to draw the diagram and you should explain in the exam if they ask to explain about synovial joint, and this is very very important. You have to remember. Okay, so on the structural classification based on the presence or absence of synovial cavity and based on the presence or absence of connective tissue, joints are classified into fibrous joint, cartilaginous joint, and synovial joint. Okay, so now see, this is total classification of joints. So we were discussing about structural classification. In structural classification, we have fibrous joints, cartilaginous joints, and synovial joints. In synovial joints, further synovial joints are again classified into 6 types. In that, we have gliding joints, hinge joints, ball and socket joint, pivot joint, ellipsoid joints, and saddle joints. So about all these synovial joints we'll discuss. We'll discuss about fibrous joints also. In that, sutures we have, syndesmoses we have, okay, gomphosis, all these things we'll discuss now. And about functional classification, that anyways about these joints in functions we will discuss. So this classification is not needed, but आपको अगर देखना है तो you can see. But this classification is important. Okay, joints are classified mainly into fibrous, cartilaginous, and synovial, and they are further classified into sutures and all. I'll discuss now. Clear? Now you see. Just now, as we discussed, mainly in classification of joints. In classification of joints, mainly joints are classified into fibrous joint, cartilaginous joint, and synovial joint. I am just trying to repeat the concepts because when I repeat, it will be easy for you to memorize and understand. Okay. See, in fibrous joint, as I told you, there is no synovial cavity and there is no synovial fluid, and these fibrous joints are held together. They are held together by a dense, irregular connective tissue, which is rich in collagen fibers. Okay. So in fibrous tissue, sutures are best example. Okay. Sutures are the joints which are present in skull, I told, cranial bones. Okay, in axial skeletal we understood. Okay, anyways about the sutures I'll explain all the points. And second type of joints is cartilaginous joint. In between the joints we have a cartilaginous tissue which is held by the cartilaginous tissue. In this there is no synovial cavity and no synovial fluid. Both the bones are held together by cartilage. Okay, and synovial joints are those joints in between the bones we have synovial cavity, and these two are united by irregular connective tissue. In that we have articular capsule, as we discussed. Just imagine this is a bone, this is another bone, and in between these bones there is a space which is called synovial cavity, and this synovial cavity is filled by synovial fluid, and this is called synovial capsule. Synovial capsule which is surrounding around the synovial cavity, and along with that it is also having some accessory elements like ligaments. It has ligaments, it has cartilage, it has synovial fluid, jelly substance like that, and it has some muscles also here. Okay, so this is called synovial joint. Synovial joint. And in synovial joints, as I told, it is further classified into 6 types. That all we'll discuss now. Okay, so this is main classification, you should not forget: fibrous joint, cartilaginous joint, and synovial joints. Now we will discuss about fibrous joints. Fibrous joints, very very important. Fibrous joint, you already understood. Fibrous joints are those joints which are not having synovial cavity, they are not having synovial fluid, but they are held together. They are held together by irregular collagen fiber. There is a fiber here. Collagen fiber is present between the two bones. Okay, so this type of joints are called fibrous joints. In fibrous joints, further they are classified into 3 more types. In that, the first one is sutures. Second one, they are syndesmoses. Syndesmoses, very very important. And third class of fibrous joints are interosseous membrane. Interosseous membrane. So fibrous joints are further classified into sutures. Sutures are a particular type of joints which will connect the bones of cranium. And syndesmoses or fibrous joints, they will connect together. They will connect together with the certain bones, like we have bones of teeth. Okay, they are the examples of syndesmoses. And there are interosseous membranes. We have what we can say, we have tibia and fibula. Okay, tibia and fibula bones are joined together with a membrane. That joint is considered as interosseous membrane or interosseous joint. So these are 3 different types of fibrous joints. I'll try to show you some images, and with that you'll try to understand. याद रख लो fibrous joint के अंदर how many types we have? We have sutures, syndesmoses, and interosseous membrane. Now you see. Yeah, just I told fibrous joints. In fibrous joints, they don't have synovial cavity. Synovial fluid is absent. Okay, and they are connected with irregular dense connective tissue. Few will move, but few will not move. Majority of fibrous joints are immovable. Yeah, yes. So just now I told fibrous joints are further classified into sutures, syndesmoses, and interosseous membranes. Okay. अब देखो ध्यान से सुनना. Fibrous joints are very important. Now you see, in fibrous joints, first type of fibrous joints are sutures, right? In previous class already I told you what is suture. These sutures are fibrous joints which is present. I'll try to show you the images. With the images it will be easy for you. Yeah, you can see these are bones of cranium. Cranial bones, we say cranial bones. In previous class we studied this is a frontal bone. Actually here you see there is a suture here. In previous class did I tell you that frontal bone is divided into two halves? I didn't tell you. Why? Because this is a temporary suture. Actually this suture is present in children, but gradually after 6 years this suture will disappear. Okay, that's why the frontal bone is a single bone. This is a single bone. Actually frontal bone is a single bone. There is no suture in the frontal bone, but in children it is seen. Anyways, so these are the very dense connective tissues which are connecting the cranial bones. Those type of joints, these type of joints are called sutures. Very simple. They may ask you for 2 marks what you have to do, what you have to write. Define sutures and where they are located. Sutures are the only joints which are present. Sutures are only joint which are present between the bones of cranium or cranial bones. First point. And these bones are having greater strength. They are having good strength. Mostly they are immovable. Mostly immovable. Few are movable, but mostly they are immovable. And this strength is caused due to the presence of irregular locking system. Okay, they have irregular locking edges. Due to the presence of the irregular locking edges between the bones, they are having good strength. That's why these strengthy sutures can protect the brain from external what we can say external blows or from external trauma. Due to the presence of the sutures, they are having good strength between the bones, and due to the strength of the sutures, the cranial bones are protecting our brain due to external blows and external trauma. You have to remember this point. Okay, so just now I told few are immovable. Immovable sutures, particularly immovable sutures, are called synarthrosis. Synarthrosis. The sutures or the joints, in the joints we have certain sutures, right? The suture joints which are immovable, they are considered as synarthrosis, and few are movable. Few sutures are movable. They are called amphiarthrosis. याद रखना. What is amphiarthrosis? Amphiarthrosis is the term which explains about the movable joints in the cranium or movable sutures. Movable sutures are amphiarthrosis. Immovable sutures are synarthrosis. Understood this point? And there is another very, very important point. There is another point called synostosis. Synostosis. You know what is synostosis? Synostosis is the term which is actually in neonate and children till 6 years. The frontal bone is divided into 2 halves, and that 2 halves were divided by one suture which is called frontal suture. Initially this frontal suture is dividing the frontal bone into 2 types. Okay, after 6 years what will happen? This frontal suture will disappear and it will totally make that bone to stop or to stop the moving nature. I mean, it will convert it into immovable bone. Immovable bone. This type of suture is called synestosis. Synestosis is disappearing of the suture after 6 years of after 6 years in the children is called synestosis. Okay, these three terms are very important. I think you understood about sutures. Say sutures are present in particularly in cranial bones. They are having good strength because they are having locking edges, and the fibrous tissue which is present between the bones are very important. They will lock the bones of cranium, and few bones are immovable, few are movable. Immovable sutures or immovable bones are considered as synarthrosis, and movable are considered as amphiarthrosis. And there are certain sutures which are disappeared after particularly after 6 years or 7 years. That type of disappearing suture is considered as synestosis. I'll just show you the image just now. I told no. The synestosis, it is also called metaphysic synestosis. Okay, it is disappeared in adults, or it is also called, this one is just now what I told, it is a frontal suture. I told frontal suture. It is also called metaphysic synestosis or metaphysic suture. It is also called metaphysic. Here it is already written metaphysic suture or frontal suture. After 6 years, this metaphysic suture will disappear, and it will the disappeared metaphysic suture is considered as what it is called synestosis. Okay, disappeared metaphysic suture is called synestosis. Clear. I think you understood about these sutures in fibrous joint. In fibrous joint, we have sutures, syndesmoses, and interosseous membrane. In that, we discussed about sutures in detail. Okay, sutures is done, and next is we have syndesmoses. Next is we have second type of fibrous joints or syndesmoses. In this fibrous joint, there is no synovial cavity and there is no synovial fluid. The best example of this syndesmosis is the joint between tibia and fibula. Tibia and fibula, tibia, fibula, and also radius and ulna, and tibia, fibula. Particularly tibia and fibula. In between tibia and fibula, there is a joint. You can see this is the joint which is considered as syndesmosis. Okay, tibia, fibula ke in between we have certain fibrous tissue. This fibrous tissue is connecting this bone and this bone. Okay, and this is the dense irregular connective tissue. It is very dense, and it is, you see, in suture ke andar the distance between one bone and the other bone is very minute, very less. But यहाँ पे you can see the distance is quite larger when compared with suture, right? So यहाँ पे it is the distance between these two bones, there is a huge gap, and that gap is totally filled by certain fibrous tissue, and that type of joint, that type of tissue is called syndesmosis. Clear? Syndesmosis. And there is another example of syndesmosis. You can just remember, it is a bone in the mandible or maxilla. In that we have a bone root, I mean teeth root. This is also one example of syndesmosis. Syndesmosis example is tibia, fibula, and the joint between teeth and bone of our buccal cavity. Dento-alveolar joint, we call it dento-alveolar joint. Okay, this bone, I mean the teeth, is fixed into the socket. There is a socket of the bone. The socket is called alveoli socket. Alveoli. That's why this teeth and bone is called dento-alveolar joint. Dento-alveolar joint. Dento-alveolar joint is the type of syndesmosis. Clear? So syndesmosis is very easy. It is, in this you have to remember two examples. One is tibia, fibula, and dento-alveolar joint. Now next, this is dento-alveolar joint. The third type of fibrous joint is interosseous membrane. It is quite similar to syndesmosis. See, in syndesmosis, what we discussed, in syndesmosis, the two joints are interlinked by a very important fibrous tissue which is present in tibia and fibula. right? In the same way, interosseous membrane or interosseous tissue is also present in radius and ulna. Radius and ulna. Same like tibia and fibula. In radius ulna, we have this type of tissue. You can see in the image here. See, in radius and ulna, these both the joints, these both the bones are interlinked together. Okay, so this type of fibrous joint is called syndraceous in interosseous membrane. Interosseous membrane. Okay, so till now what we discussed till now in fibrous joint we have three types. One is suture, very important, that we have discussed. Second one is syndesmosis, the fibrous joint which is present between tibia and fibula, yaad rakh lo. And we have what we can say dento-alveolar joint.
Radius ulna.
Radius ulna also, but radius ulna mainly you have to focus. Radius ulna is mainly seen in interosseous membrane, interosseous joint. This one is important. In this we have radius and ulna. Radius and ulna example is interosseous membrane. Okay, tibia fibula best example is syndesmosis, that you have to remember. Okay, so these are three types of joints which is present in fibrous joints. Clear about fibrous joint? It is clear now for you all? Fibrous joint is very easy. Fibrous joint is very easy. Fibrous joint के अंदर अपने को sutures है. Skull के अंदर जो भी sutures joints we have, they are fibrous joints. And syndesmosis here in this, always remember tibia and fibula. Between tibia and fibula we have membranes or cartilaginous, not fibrous tissue, we call it connective tissue. It is connective tissue. You might have studied about different types of tissues. Okay, and in interosseous membrane, best example is radius and ulna. Okay, so these are three different types of fibrous joints. Now, in classification, what I told, in main classification of joints, what I told, in main classification, empty slide कहाँ है भाई? ठीक है. In main classification of joints, I told fibrous joint, and I told cartilaginous joint, and third one is synovial. Fibrous joint we have completed. In fibrous joints we have three more types. In these sutures, very important sutures, syndesmosis and interosseous membrane. These three we've completed. Now we will discuss about cartilaginous joint. Okay, cartilaginous joints, in this also same, there is no presence of synovial cavity and synovial fluid, but the two bones are joined together with the help of a cartilage. That's why they are called cartilaginous joints. Simple. Best example of cartilaginous joint is joint between first rib and the head of manubrium. Here, this, what is this? This is the head of sternum, right? अपने को in previous class I told sternum is divided into three parts. The head of sternum is called manubrium, and this is body, and this is tail, or the third tail part of sternum is scaphoid process. Okay, so in previous class already we discussed sternum is divided into three parts. The head of the sternum is called manubrium, the body of sternum is body, and the third is scaphoid process. Anyways, now you see on the head of sternum, is called manubrium. At the manubrium, the first rib is coming and connecting to the manubrium. But see, always remember, first rib and most of the ribs, they don't directly come and join to the sternum. They don't join directly to the sternum. They will join with the help of cartilage. Here, cartilage is joining with the sternum and rib. So the example of cartilaginous joint is the joint between the first rib and manubrium. These both the bones are connected together with the help of a cartilage, which is called synchondrosis, or which is considered as cartilaginous joint. Clear? So this is the example of one cartilaginous joint, the joint between first rib and manubrium of sternum. And second example in cartilaginous joint is the joint between the pubic bone. Okay, in pubic bone there is a pubic symphysis. This pubic symphysis is the cartilage which will connect the pubic bone from both the direction. Okay, this is another example of cartilaginous joint. So second one is done. In cartilaginous joint, it is very simple. Both the bones or two or three bones are interlinked together with the help of cartilage. That is called cartilaginous joint. In that first example, you have to write the joint between first rib and manubrium of sternum. Clear? Now, next is very important part of uh, joint is synovial joint. The third type, as I just explained you, in that you see in main types of joints, first one is fibrous joint, second is cartilaginous, and third one is synovial joint. Now, dhyan se sunna, synovial joint is very very important, and in exam they will ask this question. Whoever makes the question paper, if he selects the question from joints or skeletal system, definitely he will ask question from synovial joint. Clear? याद रख लेना. But other joints अभी पूछ सकते हैं 2 marks के. You have to be ready to write the answer. Okay, but for 4 marks definitely they'll ask you explain about synovial joint, features of synovial joint. They'll ask. First point about synovial joint. Mainly majority of joints are classified under synovial joints. Number one, these joints will contain a cavity between two bones. They will contain a cavity between two bones, that is called synovial cavity. Synovial cavity. And this synovial cavity is filled with synovial fluid, and it is connected together by two bones by a capsule which is called a joint capsule. Finish. Synovial fluid is present in synovial cavity is lubricant. It will act like a lubricant, and it will protect from shock absorbers. Okay, it will act like shock absorber. This synovial joint will act like a shock absorber when we run, when we jump, when we do some activities, physical activities, bhagna, dodna, nachna. In that all physical activities, one bone will not directly contact with the other bone. If bone and bone contacts, what will happen? It will cause friction, and with that it will damage bones. कभी भी देखना, एक एक बोन और दूसरे बोन दोनों अगर if it is continuously contacting together, I mean if both the bones are touching continuously, if they are in contact continuously, it will cause friction, and with that friction it will damage the bones. To avoid the friction, the bones are modified themselves with a synovial cavity and synovial joint. Okay, synovial joint is the modified type of joint, and it will protect the bones from different physical activities, and they'll act like shock absorber. This is important. Okay, and synovial joints enable a wide range of movements like bending. It will helpful for bending, straightening, rotating, gliding. We'll discuss about all the types, and the examples of synovial joints are elbow joint, knee joint, hip joint, shoulder joint, wrist joint, ankle joint. All these are because majority of joints are present in synovial joints. Okay, now you see, this is the characteristic diagram of synovial joint. See, this is one bone and this is another bone. Both the bones are joined together with a capsule which is called synovial capsule, and between these two bones there is a cavity. This cavity is filled by synovial fluid. Okay, and this capsule is lined by synovial membrane. And always remember, the two bones on the both the bones, it is surrounded by a very very important tissue which is called articular cartilage. Okay, in synovial joint also bones are surrounded by cartilage. Okay, and this cartilage will again helpful for protection from friction. Along with the fluid, this cartilage also helps in protection from friction. So all these things you have to remember. You can draw this diagram. When they ask you about synovial joint, you have to draw this diagram, label the parts, and explain about the features about this joint, which is very simple. Now, see, in synovial joints we have different types. Synovial joints are further categorized into 6 types. In that, first is gliding joint or plane joint. Second is hinge joint. This is hinge joint. Third is pivot joint. Okay, pivot joint. Fourth one is condyloid joint. We have saddle joint and ball and socket joint. Very very important. Ball and socket joint. In exam they may ask you write about ball and socket joint, or they may ask you for 2 marks, where does ball and socket joint located, like that, or write about pivot joint, plane joint. They will ask you for 2 marks, and it may also come for 4 marks. They will tell you classify synovial joints and write in brief note about all the joints they will ask. Anyways, now you see, we will try to discuss about all these types of joint. The first one is plane joint. Okay, see, plane joints are also called planar joints. The examples of these planar joints or intercarpal joints, okay, and intertarsal joints. We discussed about tibia, fibula, radius, ulna, carpals, metacarpals, tarsals, metatarsals, phalanges, right? See, in hands, in palm, we have carpals, metacarpals, and phalanges. Yes. So the joints between carpals, I'll try to show you the image. See, we have how many carpals do we have in our arm? Who will tell me?
16.
8 plus 8. But
16.
in tarsals, here in tarsals we have 7 plus 7. Yaad rakh lo, okay? The joints between these carpals, are the examples of planar joints. Okay, planar joints are the joints which is present between the bones of carpals and between the bones of tarsals. Tarsals and carpals के बीच में जो भी joint है, they are called planar joints. Okay, these planar joints will help for the movement in either one direction, or actually they don't have exact movement direction. Okay, they will just help to slide the bones, you can see. That's why they are called gliding joints. They are called gliding joints. Okay, in one plane only they are helpful in the movement. So in examples of planar joints, one is intercarpal joints, second one is intertarsal joints, and third one we have acromyoclavicular joints. In previous class I told what is clavicle. Clavicle is the collarbone which is going, and it is sitting on the scapula. It is sitting on the acromion of scapula, and it is forming a very small joint, gliding joint or plane joint, which is acromyoclavicular joint. I'll try to show you the image. See here, acromyoclavicular joint. Here you can see कहाँ है, clavicle के पास जाके acromyoclavicular joint here. In clavicle I told you three main parts. Okay, one part is acromial process. On acromial process, this clavicle, this is a clavicular bone or collar bone, which is called collar bone. See, clavicle, this is coming and sitting on the acromion, and it is forming acromyoclavicular joint. Okay, so acromyoclavicular joint is also the example of planar joint. Okay, understood. And one is, yeah, third one is acromyoclavicular joint, and fourth one we have sternocostal joints. Okay, anyways, you just try to remember this intertarsal, inter sternoclavicular and intercarpal joints. All these are examples of planar joints. I think you understood what is planar joint. Yeah, the planar joint. You can just write this example as planar joint. Intercarpal joints and intertarsal joints and sternoclavicular joints are the examples of planar joints. Clear? You can see here also. Okay, acromial process of scapula. Okay, and yeah, अब देखो, next one is second class of synovial joint is hinge joint. This is important, quite important. Hinge joint, it is also called gingivimus joint or gingivimus joints. You can pronounce whatever you feel comfortable. Okay, the convex surface, you know what is convex? Convex means like this. Concave means, I mean, if something is there like this, it is going and fitting into the concave. This is concave, this is concave, and this is convex. Convex surface of bone fits into the concave surface of another bone. This is concave and this is convex. Convex जाके क्या कर रहा? Convex में जाके बैठ जा रहा. It is going and sitting in the concave surface of the another bone, and this type of joint is hinge joint. Okay, and this hinge joints will produce angular movement at one angles. For example, it will see the joint will move like this. It will move in one direction, or again it will move in opposite direction in angular side, angular movement, opening and closing motion. For example, see, we have certain bones like knee joints, elbow joints. We have knee joint, elbow joint, and ankle joint. All these are the joints of hinge joints. And here you always remember, in hinge joint, one point is the concave part of bone is going and fixing into the convex part of bone is going and fixing into the concave part of the bone, right? And one bone always it remains in fixed position while the other one is moving in axis. यहाँ पे देखो, I'll try to show you this image. The best example is here we have knee joint. This is knee joint. This is elbow joint. Knee joint and elbow joint, always see the femur is fixed at one position, and we have tibia and fibula. Tibia, fibula is moving in this direction and in this direction. Okay, angular movement होते रहता है. Okay, this is one example. And this is elbow joint, same. The humerus, and we have radius and ulna. This is also moving in one direction, angular direction. And here also ankle joint, these also moves like this. And we have certain joints in interphalanges. We have phalanges, right? Phalanges means in fingers jo joints hai, they are phalanges. These fingers also moves in one direction. Okay, we can close the fingers and we can open. एक डायरेक्शन में क्लोज हो जाएगा फिर ओपन हो जाएगा ऐसा. Okay, so angular movement with the joints which will show angular movement are called hinge joints. In that, knee joints are best example, elbow joints, ankle joints, and interphalangeal joints. Okay, understood about hinge joint. This is second type of joints which are present in synovial joints. Now the third one is pivot joint. I think everybody are following me. These are also called trochoid joints, and these are rounded or pointed surface of one bone articulates with the ring form partly by another bone and partly by ligament. यहाँ पे best example is atlantoaxial joint. In previous class I told, see, we have C1, C2. C1 is called atlas and C2 is axis. Okay, atlas will sit on axis. I'll try to show you the image better for better understanding. याद रख लो, on the atlas we have cranium. Yes, on the atlas we have cranium. This atlas is sitting on the axis. Atlas is C1, axis is C2. This atlas, what it does, it will move in this circular direction. It will help to move the head in different direction. You can look back and you can move your head side by side. Okay, यहाँ पे you can rotate your head, and that is because of the presence of pivot joint. Pivot joint is the example of atlantoaxial joint. This is atlantoaxial joint. Atlas and axis के बीच में जो भी joint है, this is special joint actually. This type of joints are very rare and it is present in skull between atlas and axis only. And also it is present in radio ulnar joints also. Radio ulnar joints कहाँ है? See, just in the we have just below the wrist. You can take your hand. Wrist पकड़ो, punch. You just try to catch the punch and you just rotate your punch. Punch करो, you can rotate. Okay. पे है. यहाँ पे I think I didn't include that, but remember this atlantoaxial joint is the example of pivot joint. Okay. Now next is condyloid joints. Condyloid joints is the fourth type of synovial joint. These condyloid joints are ellipsoidal joints. Here you see, always remember the convex oval shaped. इससे पहले अपन we have seen, we discussed about hinge joint. Okay, hinge joint is different. Okay, hinge joint is also same. Here convex bone is going and sitting in the concave bone. Here also it is sitting in concave only, but the convex oval shaped projection of the bone fits into the oval shaped depression or convex. यहाँ पे it is always present in oval shape. याद रख लो. Those type of joints are condyloid joints. Okay, these are ellipsoidal joints. Ellipsoidal means they are oval like this. Oval में रहते हैं. Okay, you can see the condyloid joint in the figure. If you see the figure, it will be easy for you to understand. Examples of condyloid joints are radiocarpal. Okay, in the wrist we have radius and ulna, right? Radius will go and it will attach to the carpals. Here it will come and attach to the carpals. That is one example of condyloid joint. And metacarpalophalangeal joint. This is okay. You can see this metacarpalophalangeal joint between the metacarpals and proximal phalanges, particularly the first phalange. Finger के first phalange होता है proximal. This joint, this one and this. Okay, this joint. I'm sorry. So in condyloid joints, metacarpalophalangeal joints is the example. Between this joint is present between metacarpals and proximal phalanges. Okay. Anyways, this is mainly present in the fifth digits of the joint. Anyways, jab dekho. Third one is saddle joint. Okay, this is fourth. I think this is fourth or fifth. Yeah, this is fifth. Fifth type of synovial joint. Is saddle joint. You can see the image. Okay, it is type saddle type and it is gliding type. Okay, the convex type of bone is attaching to the concave type of bone, but it is gliding one. यहाँ पे you can see it can move this side, it can move this side, it can move downwards, it can move upwards. In few directions it can move. That type of joints are called saddle joints. Saddle joint or cellar, it is also called cellar joint. It is articular surface of one bone is saddle shaped, and the articular surface of the another bone fits into the saddle. Okay, and as a sitting rider would sit. Abhi is just it is explaining the image of this. Okay, example of saddle joint is carpo metacarpal joint. Okay, see, we have trapezium. Trapezium क्या है पता है आपको? What is trapezium? Trapezium of carpus and metacarpal of thumb. Between these two, this joint is there. You can see. You can just take your thumb. For example, this is your thumb, and we have fingers. Here we have a joint. This joint can move in different directions. Here it can move in different directions. But whereas these four fingers, they can't rotate. You can't rotate your these fingers, but this thumb finger it can rotate. Why? Because in this we are having saddle joint. ठीक है? And let me see the other image. दूसरा image नहीं है यहाँ पे. Okay, so carpometacarpal joint is the example of saddle joint. And next is ball and socket joint. Very, very important. This is sixth one. Sixth type of synovial joint is ball and socket joint. Very, very important. It has different movements. How many movements it can do? It can do extension. मतलब बाहर it can open the tissue outside. It can show abduction. Inside movement it can do, and it can also cause rotation. Rotation also it can do. Okay, these 3-4 types of movements these ball and socket joints can do. I'll just tell you the examples. These ball and socket joints are present in shoulder and hip joints. Very, very important. I told shoulder girdle and we have pelvic girdle, right? In shoulder girdle we have very, very important femur, or in shoulder girdle the head of humerus will come and it will sit into the glenoid cavity of scapula, and that will form ball and socket joint. I'll try to show you the image. You see, this is scapula. This bone is scapula. Here already it is written. The scapula is having 3 processes I told. One is glenoid cavity. Here glenoid cavity. We have acromion, and we have one more process where muscles are attached. In previous class I told. Okay, see here the glenoid cavity is, in this glenoid cavity the ball is coming and it is attaching to this socket. That's why it is called ball and socket joint. The head of humerus, this is humerus. Head of humerus is coming and sitting into the glenoid cavity. Okay, that's why it is called ball and socket joint. So this is one example. And second example is femur. Head of femur is coming and sitting into the acetabulum of our hip joint. I mean in the hip region, especially in the acetabulum of hip joint. That is a hip bone. That is example of ball and socket joint. You can see in the image here. See, in the acetabulum cavity, in acetabulum, the head of femur is coming and it is sitting nicely. This is the example of ball and socket joint. Ball and socket joint ke always remember glenohumeral joint, where humerus head comes and sits in glenoid cavity, and it forms glenohumeral joint. And the head of femur comes and sits into the acetabulum of our pelvic girdle, and it forms a ball and socket joint. Okay, acetabulum याद रख लेना. ठीक है. So this is about ball and socket joint. So let's revise about synovial joint. Synovial joint के अंदर कितने हैं अपने पास? Synovial joint, planar, hinge joint, pivot joint, condyloid joint, saddle joint, and ball and socket joint. So in planar joints always we have seen intercarpal and intertarsal. याद रख लो. Sternoclavicular also planar only, and hinge joint. And next is pivot joint. Hinge joint याद है ना? In angles में movement दिखाता है. It will show movement in angle, in single angle. Best example is knee joint and elbow joint. And in pivot joint, it will move in circular movement. Atlantoaxial joint is the best example of pivot joint. Atlas of the first cervical vertebrae, first cervical atlas is moving on the axis. Okay, and condyloid joint. Fifth one is saddle joint, and sixth one is ball and socket joint. In ball and socket joint, the head of humerus sits into the glenoid cavity of scapula, and head of femur sits into the acetabulum of pelvic girdle. Okay, so these are different types of synovial joints. Now the movements of joints, and about special, we have some special joints or modified joints that we will discuss in next class. Before that, I'll try to tell you some disorders of joint. With this, we will complete all types of joints. See, in disorders of joint, there are certain diseases. Always remember, there is one disease called osteoarthritis. This will come in 2 marks. Always remember. Disorders of joint, you can expect question for 2 marks. Osteoarthritis. Arthritis means inflammation of joint. Osteo means bone. याद रख लेना. Here, in this osteoarthritis, the joint or bone degradation can be seen. Degradation of the joints. Okay, it is a degradative joint disorder or degenerative joint disorder. Joint disorder is called osteoarthritis. Joints, here the bones and the joints, cartilage, or all the accessory joint substances जो भी है अपन synovial joint के अंदर, whatever we have discussed, in that if anything is missing, if anything is deficient, if bone degradation is seen, that will cause osteoarthritis, and with this it will cause a lot of pain in joints. This type of joint disease is called osteoarthritis. This is mainly seen due to deficiency of certain hormones, estrogen, progesterone, or due to trauma. Okay, there are so many reasons for osteoarthritis. Okay, so osteoarthritis is the degenerative disorder of joint, and with that patient will feel lot of pain in the joints. Okay, this is important. Next one, the second type of joint disorder is rheumatoid arthritis. Rheumatoid arthritis. Joint के अंदर कहीं पे भी inflammation आया ना, that is called arthritis. If any inflammation occurs in joint, that is arthritis. Arthritis means inflammation of joint, pain, redness, all. Rheumatoid arthritis particularly, it is a autoimmune disorder. Autoimmune disease. Actually, what happens, for example, just imagine this is a joint. Okay, this is a joint. In this we have cartilage, here we have synovial fluid and all. Here we have tendons or muscles, everything. In rheumatoid arthritis, what will happen? There are certain antibodies. These antibodies will go and it will degrade the tissue in the joint. Joint के अंदर it will cause degradation. It will cause inflammation, and it will cause pain in the joint. This type of autoimmune disorder is called rheumatoid arthritis. Simple. Rheumatoid arthritis is the autoimmune disorder. Autoimmune means antibodies are produced by our own body. Our own body will produce some antibodies which will go and attack to our own tissue. That's why it is called autoantibodies. That's why it is called autoimmune disorder. So rheumatoid arthritis is an autoimmune disorder where certain antibodies which are produced in our body will go and it will destroy our own joint. And that is called rheumatoid arthritis. Okay. Next one is we have gouty arthritis. Gouty arthritis. Same, arthritis means inflammation in the joint, pain in the joint. Here gouty arthritis means, see, in some joints what will happen, we have a very important excretory waste product which is called uric acid. Uric acid is continuously produced in our body. It will slowly excrete from urine. But in some situations what will happen, this uric acid concentration increases and this will go and it will accumulate in joint के अंदर जाके वो it will start accumulation, and with that it will cause inflammation in the joint. That type of inflammation in the joint, pain in the joint, is called gouty arthritis. Gouty arthritis is directly linked with uric acid production. Excess uric acid will accumulate in the joints and it will cause gouty arthritis. Very simple. Next type of joint disorder is there is an infective condition which is called Lyme disease. Lyme disease करके, actually आज के ज़माने में this disease is not prevalent, but in previous days there is a bacteria which will cause joint stiffness, joint pain, and it will cause arthritis. And the name of the bacteria is Borrelia bacteria. Borrelia Burgdorferi बोलते, Burgdorferi, एक्चुअली स्मॉल बी आना है. Borrelia Burgdorferi. This is the name of the bacteria. This Borrelia bacteria, it will cause joint stiffness in the joints, and with that it will cause joint disorder. So that disease is called Lyme disease, which is a infectious condition which is related to joints, bones. Okay. And there is one more disease which is called tenosynovitis or tendonitis. We call it tenosynovitis. Tenosynovitis means here in synovial fluid the tendons will break down and muscles will break down, and with that it will cause damage in the damage in the joint. With that, it will cause tenosynovitis. This is another joint disorder. Actually, it is mainly seen in athletes. Okay, physical activity जो ज़्यादा करते हैं, those who perform gym activity. Okay, for them, this tenosynovitis, breakdown of tendons in the bones can be seen, and with that, in the joints, in that it can cause joint inflammation. Okay, so over strenuous exercises also can cause tenosynovitis. Certain drugs also will cause tendonitis. बोलते हैं tendonitis. Tendons will break down due to some drugs. We have some corticosteroids, fluoroquinolones, some antibiotics. They will damage tendons. With that also it will cause joint disorder. Okay, so these are about certain disorders of joints. I think थोड़ा बहुत समझ में आया होगा. So in next class we'll try to continue some other concepts. I think इससे ज़्यादा एग्जाम में कुछ पूछेंगे नहीं. With this, I think most of the joints, names of joints, disorders of joints, their characteristics, types of joints, classifications, their movements. So with this, we will stop here. We'll continue in the next class with some other concepts. So if you liked our video, if you learned something from our video, please don't forget to like, subscribe, and share this video with your friends, so that sharing is caring. Sharing knowledge is very important. Okay, thank you.